We are discussing a study published in 2022 by Aras Kafari and his colleagues from the Interdisciplinary Orthopedics Aalborg University Hospital and Aalborg University in Denmark. The study is titled Criterion Validity of Linear Accelerations Measured with Low Sampling Frequency Accelerometers during overground walking in elderly patients with knee osteoarthritis. So this research focuses on the validity and reliability of low sampling frequency accelerometer measurements, specifically the Fibion SENS in patients with knee osteoarthritis. So let's start by setting the scene. So you can picture a patient with knee osteoarthritis walking in the comfort of their own home, and they have attached to their thigh a small device, the Fibion SENS device, that's continuously monitoring their gait accelerations. So this device is a low sampling frequency accelerometer, which means it can run for extended periods without draining the battery. So the question that arises here is, can this low sampling frequency accelerometer provide valid and reliable data? So this was the central question that the study we are discussing today aimed to answer. The study was conducted with 44 participants, all of whom had different stages of unilateral knee osteoarthritis. And the researchers collected data using both the Fibion SENS and previously validated sensor during 2 repetitions of overground walking. The processed acceleration signals were compared with respect to different coordinate axes to determine the retest reliability and the agreement between the 2 systems in the time and frequency domains. The study found that the Fibion SENS showed good validity and reliability. The interclass correlation coefficient for the repeatability of Fibion SENS measurements was between 0.93 and 0.96, which indicates excellent reliability. And in terms of validity, the concordance correlation for the agreement between the Fibion SENS and the previously validated sensor were between 0.81 and 0.91 in the time domain and between 0.43 and 0.99 in the frequency domain. So these results suggest that Fibion SENS can provide relatively valid data for measuring the gait accelerations in patients with knee osteoarthritis. However, the study did find some limitations with Fibion SENS. For instance, there was a slight gradual drift from the line of equality as the accelerations increased or decreased from -1 on the x-axis and 0 on the y and z axis. This suggests that Fibion SENS might not be as accurate at higher or lower accelerations. Despite these limitations, the study concluded that low sampling frequency accelerometers like Fibion SENS can provide relatively valid data for measuring the gait accelerations in patients with knee osteoarthritis. This means that these devices could potentially be used in the future for remote patient monitoring, which could be a game changer in the management of knee osteoarthritis. So devices that can measure for extended durations could potentially change the way we monitor and manage with knee osteoarthritis. And as always, there is more research that is needed. There needs to be more studies to confirm these findings and further explore the potential of this kind of accelerometers in the actual management of knee osteoarthritis. I hope you find the discussion useful. Have a brilliant day.